Hi everyone, I am Dr. Karthik, Consultant Senior Physician at Lakshmi Multi-Speciality Hospital, Sunkutkata. So as you are all aware, now it's a season of monsoon. So we might feel overwhelmed that the rain is coming. But at the same time, this monsoon season carries its own disease burden. So among the commonest diseases which we encounter in this monsoon season, let me just brief you about one of the most common viral illness which we encounter here. That's the dengue virus or the dengue illness. So now coming to what exactly is this dengue infection. So this dengue infection is a typical infection, viral infection which occurs in the monsoon season. So the virus which transmits this dengue infection is called as dengue virus. It has four subtypes, type 1 to type 4. And how does it get transmitted? So it is transmitted to the mosquito. The name of the mosquito is called as Aedes aegypti. And how does it happen? How does the basic transmission of this virus happen? So for example, the virus is taken up by the mosquito. As I told, it's Aedes aegypti. It bites on a particular person and the virus is transmitted. This mosquito is a typical daytime biter. So one of the commonest method how it gets transmitted is the mosquito which transmits the virus and bites a particular person. So what are the classical symptoms of this dengue infection? So this dengue infection has a wide range. It can range from a simple flu-like illness to a complicated condition called as a dengue shock syndrome. So going to the typical classical features of this dengue fever. So most commonly the people who have this infection presents with high-grade fever. So they'll have a lot of fever with chills and the temperature usually goes on 102, 103 degrees. So along with that, what are the additional symptoms? The other classical symptoms are typical body pain and joint pain. Hence it is also called as a breakbone fever, where the patients experience a lot of joint pains. And the other classical symptom of this dengue infection is a retroorbital pain, meaning there is a significant pain behind the eyes. So these are the classical manifestations. Along with this, the people or the patients affected by this can also have excessive vomiting, loose motions, and on examination they can have rashes, the BP can drop little. So, these are the typical features. Suppose the other extreme is called as complicated dengue, where it's usually called as dengue hemorrhagic syndrome or the dengue shock syndrome. So what exactly is the mechanism? So when the virus affects the person, usually the virus multiplies in the body and it destroys the platelet count. Once the platelet becomes very low, for example, the normal platelet is around 1.5 lakhs and above. When the platelet count significantly decreases to about less than 20,000 or 10,000, the patients experience significant bleeding manifestations. So this is what is called as dengue hemorrhagic syndrome. And once the bleeding manifestations or the infection level is too high, then the patients develop something called as a complicated dengue, where it's manifested as a dengue shock syndrome. So what exactly is this dengue shock syndrome? So in this, the patient has a high-grade fever, significantly toxic, there'll be bleeding manifestations, and the BP recording is very low. They can have BP like 60 by 40, something like that, and they'll have diffuse third space losses, water accumulation in the lungs, in the abdomen, and there'll be significant pain abdomen. So any person with a fever lasting for more than 3 to 4 days, experiencing little bit of breathing discomfort, any bleeding manifestations, the blood pressure recording is low. So these are the alarming symptoms which we need to be concerned about. So this is about the symptoms where it can, as I told, it can last from a typical flu-like illness to a significant dengue shock syndrome. So how do we diagnose this dengue? So the diagnosis is one, clinical presentation by the various signs and symptoms which I described. Plus we do the complete blood count, where invariably the platelet count would have been low. Then we do the dengue ELISA test to find out the dengue infected virus. So this is the common diagnostic modalities. So what is the treatment aspect? So as we all know, the majority of the treatment for most of the virus is symptomatic, meaning just treat the present symptoms. Patient has a fever, give paracetamol to reduce the fever, but the mainstay of the treatment remains good hydration or IV fluids, so to maintain the hydration levels. And any person experiencing other typical features like a excessive bleeding manifestation where the platelet count is significantly low, we do consider about platelet transfusions. And severe modality where the patient has a dengue shock syndrome, we give certain medications to pick up the BP called as inotropic support. So overall, the basic management is there is no specific antiviral therapy. It is basically symptomatic treatment, and based upon the symptoms or complications, we do the treatment. So how do we prevent this? So that's the most important. So as I told, this is one of the diseases of the monsoon or the rainy season. And previously, as I described, the mode of transmission is through the mosquito. So what are the precautions we can take so that we can prevent these measures? The most important precaution is to avoid breeding places of the mosquito. What do you mean by breeding place? It's a place where the mosquito lives and multiplies itself. So the common source of breeding place of this Aedes aegypti mosquito is a stagnant water. So wherever there's a stagnant water, so this mosquito multiplies itself. So the most important modality of prevention is to eliminate this stagnant water sources. So we are eliminating the mosquitoes in turn. The second, as I told, this Aedes aegypti is a daytime biter. So ideal precautions would be to wear full arm sleeves and full arm clothes so that we can avoid the mosquito bite as much as possible. And one other option is we can use mosquito repellents. So may not be much useful, but still give some precautions. And other most important advice what I would like to suggest is any person experiencing high grade fever lasting for more than 3 to 4 days, better not to neglect. I think you have to take immediate medical attention, approach to your nearby doctor, watch for the alarming symptoms, do the relevant test, and then we can proceed from there on. So this is a brief overview about the dengue virus. Thank you.